Welcome to Last Station. I am Zen, your host for this series. In Last Station, we look at death from a different perspective. Rather than avoiding the topic altogether, we want to be able to plan for death. Both birth and death are the beginning and ending of our life story. We are always excited at the beginning, just like reading a book. We will fully devote the first few hours reading the first few chapters and occasionally look out from the book, telling our friends the interesting storyline we are getting. Similarly, we can plan months before a child is born. We will read up on maternal care, buying maternal clothing and baby essential, and sharing the baby due dates with our friends and family, smiling. We celebrate birth. When it comes to the end of the story, many will have lost their interest. Some would remain captivated in the climax section of the story and refuse to move on. Some would, based on their experiences, assume the ending to be the same as any other stories and totally skip the last few chapters. Either way, the ending is presumed to be dull and unworthy to spend another minute on it. Similarly, most people do not talk about death, let alone to plan for it. Today, we have with us someone very experienced in estate planning. He is not only an estate planner, he is also an end-of-life companion to patients who are at the last mile of their life. I'd like to introduce Bernard.
Hey, hi Zen.
Hi Bernard, thank you to be with us today. Would you like to share with us some of your work?
Yes, actually I'm a financial planner and specializes in the area of investments. Of course, in the last 10 years, I worked beyond investments and developed a niche in handling of finances and also end-of-life matters for patients walking in the last mile of their life. Actually, all this sounds strange because how can finances and also end-of-life matter all come together? But actually, it's very connected. The real reason is because as a financial planner, sometimes we handle things like insurance, but how many insurance policy can a person actually have? That's just that number. Beyond that, the client will be moving on to have investments like stocks, bonds. He will have assets with him as well, like at least a HDB, and sometimes even one or more investment properties. Yeah, actually that's where we start to come in to work as an asset manager across with the clients. And of course, towards the end of life, that's where the client will need to transfer some of all these assets across over to his next of kin. And that's where we come in that wealth transfer process. And of course, towards the end of their life, when medical conditions come in, we step in as an end-of-life companion across with them to walk this journey. So when we're walking this journey across with the clients, that's where they change from just being a client to a patient across over with us. And we walk through this end-of-life journey with them all the way until the point of death. And straight after this onset of death, we will accompany the deceased over to the funeral home. And sometimes we even go through the whole embalming process across with them, the washing, cleaning, and dressing up, and of course throughout this whole funeral process. So only after this funeral process, then that's where we step back into the financial role, and we'll follow up with the family on the distribution of the assets and reading of the will. And of course, after that, sometimes we will set up a trust in the name of the deceased as well.
Wow, this is amazing. You seem to have expanded the role of a financial planner to include caregiving and social support. Can you elaborate and tell us more about your role as an end-of-life companion?
Yes, so the whole end-of-life companion is actually a social support over to the patient who is about to be dying and also with the families around them. But I need to be very clear, the end-of-life companion is not a medical support. I actually work together with the palliative team, with the nursing and the support team, and to come together to provide emotional, physical, and even psychological support over the patient and his next of kin around him. Actually, this whole term of end-of-life companions started off with the term doula in the Western world. The doula is actually a lady who supports a pregnant mother throughout the whole process of pregnancy, all the way until where the child is born and born into the world and the next few months. So we reverse the doula terms for the passing on and the dying patient as well. And that's where we come in with a very strong emotional and family support across the person who's actually dying. So actually a lot of time, death can be cold, sterile, and sometimes even lonely. And actually recently with COVID, the situation is made even worse. Because in hospital, nursing homes, and even in hospice, the number of visitors to all these places has been cut down. And sometimes some of the nursing homes don't even allow visitors at all. And if a patient is passing on, he may not have all his next of kin around with him and all the loved ones. Especially for us, if we are parents, we may not even want to bring our young children over to the hospital because we might be worried that they might be infected. Yeah, and even recently, funerals, cremations, and burials has been very limited. A funeral wake is limited to probably 30 people or even lesser. And at times, I've even had cases where the families choose not even to have a funeral wake across for the family. This sometimes becomes a very big issue because the patient suddenly passes on and is disappeared away from the whole family. And this leaves really an emptiness across in the family, and they may not be able to process that grief as per how normally we actually do it. So of course, in the last 18 months of COVID, my life as an end-of-life companion becomes even more important because I would want to start as early as possible and to work with the patient all the way from chronic illness until when they move towards critical illness and terminal illness.
This is interesting. As an investment and financial planner, I know about critical illness and terminal illness. And you mentioned that you work with the family on the onset of the chronic illness. How do you work with them so early of the medical journey?
I actually start off by understanding the client, and I need to start that in the very early phase of his illnesses. Because a lot of time we have a lot of assets and a lot of financial instruments. Maybe let me use a very recent case to share across with you. So in the last few months, I was working with a gentleman. He's a painter and he has a very large collection of private art pieces. So in the last few months, I was photographing, I was taking down stories of all these art pieces. And the work is so much that it's not only done by me, I had to get the help of 4 of my probate lawyers. Even one of my colleagues from IFAS had to come in to help me to discuss and advise on the case. So all these are the work that's involved. And imagine if I had only stepped in during critical illness, or even worse, during the terminal illness of this patient. He wouldn't be able to share with me all the stories. Or rather, I would not even be able to have the time to slowly take photographs of all the artwork and to hear all the stories across from him. Yeah. And of course, the other reason why I need to be involved in the family so early is because there are many conversations that we need to go through regarding about death. A lot of time, all these conversations they are uncomfortable. They are even a taboo topic in the family. Sometimes even some of the family members were pantang about such things and do not want to talk about it. Yeah, I give some examples. Like when the patient is near death, he or she may not want to be brought back to life by life support systems. And he may say, no, I don't want to be brought back. But a loving son or a loving daughter may insist to say that if there's anything I can do to sustain the life of my loving mother or loving father, I think it's important. And they say that, yes, we should do that to save my father. And this may be a topic or a discussion that's very uncomfortable across with the family. And of course, if the patient insists that he should not be brought back based on life support system, a lot of times he can record all these things in the letter of wishes or even in the advanced care plan. And sometimes another document that I can use will be the lasting power of attorney.
Now maybe we move on to the more emotional part. Can you share with us the most emotional part of your work?
Yes, there are definitely many areas that's a bit more emotional. I must confess that for most of the cases, I actually end up tearing with the family. And that's when I talk to the patients, I plan out their death, including who they want to pass on with. Is it their loved one, their family members, or even a religious person that they want to be with them when they're passing on? Or even, are there any religious rituals that they want to perform when they are leaving? And of course, who will be holding their hands when they are in their final moments? The most emotional part is always when I ask them these questions. Are there anyone that you don't like? Are there even anyone that you hate? I really have to ask this because at times I need to go through that reconciliation process with the patients. If there's any hatred, we want to resolve that before the patient passes on. Let me show you a very simple example. Almost the very first case that I actually handled, there was a senior grandma. She had a lot of hopes and thoughts on her mind, and she hung on to life even after 7 days, whereby she had no food and she had no water. We originally thought that she would start to fade away after 3 to 4 days. But after 7 days, she was still around. And only after we made a phone call over to the son that she has not seen for the last 20 years, this son left Singapore almost 20 years ago to Europe. And only after that call was made, in a very quick process, she actually started to fade away. And only then could we stand down that vigil that we have been with her for the last 7 days.
This is emotional actually. I'm not sure myself if I'm emotionally strong enough to handle the death of my loved one. Not to mention that you have to walk the journey with so many patients and their families. Is there any work that you do to help the family remember the patients after they're gone?
Yes, that's actually what we call legacy work. So if the patient is able to work their hands, sometimes we get them to do some small little art pieces for the family. It can be a small photo album for the loved ones, sometimes a collection of recipes, or even some handwritten letters across the people whom they are closest to. But of course, if they are not able to write or even do any more work with their hands, I will still take out a phone or a camera and start filming short video footages of them sharing their wishes or their hopes for their family. And that's where I put it all together to make it a private collection across for the family after when the patient passes on.
Thank you, Bernard. We heard your sharing about the emotional aspect. Let's move on to the practical aspect. This is a question for you. Are there any trends and directions that you are seeing in this line of work?
Yes, there's a trend which has started recently. I remember when I first started this work 5 years back, most death only happened in the hospital. And remember what I shared with you about the hospital environment? It can be very cold, sterile, and sometimes a very lonely death. And the hospital environment is definitely not the best place to pass on, because over there you have patients beside you who are grumbling, who are moaning, and who may be in pain, more pain than any of us. And of course, I shared in the medical environments, in the hospital, sometimes your loved ones cannot come and visit you during this period of COVID. And of course, you know, in the hospital, every 4 hours, the nurses may have to wake you up to take your blood pressure, to check your oxygen concentration, to even check your overall pulse. And that makes a very non-restful sleep for the patients. And in these few years, I can see that most of the patients are starting to opt to pass on at home, because the home is really one of the environments where you can have the most dignified death. And that's where you can have the space for your family members, for your loved ones to be around you. And I would think this trend will be the way to go in the next few years.
Then, how would you think the end-of-life industry will progress?
I would think the industry should still progress, and I will compare it back over to the birth industry. During the birth of a child, the whole planning, the whole celebration starts maybe 8 months before the child is being born. It starts when the mother is confirmed that pregnant. There's so much work that's being done. There's medical checkups, there's maternity insurance, there's even financial planning for the child. And even after the child is being born, there's financial education, or there's even children's education that's being planned for him. There isn't so much work across all the death industry and the end of life. Sometimes the patient who passes on just fades away and just disappears from the family. And I really don't think it should be so. A lot of time the patient has a lot of personal stories to share, and his personal values will be something that we can actually learn a lot from. His experiences will have much wisdom to tell us. And I would think that in this end-of-life industry, we want to balance the harnessing of all this legacy of personal values, personal story, to balance this with the legacy of financial assets that the patient has to be transferring to his next of kin. And that might be how the whole industry should progress.
Thank you, Bernard. I can sense your passion in this end-of-life work. You are already so busy providing investment advisory to your client. You manage a team of advisors, and now you are even providing emotional and care support for your end-of-life clients, or in this case, we call patients. This is really a lot of work. Your work will feature at Singmin Daily, and you're interviewed by Channel News Asia. And recently, you received an award from President at Istana for your work at Community at Large. Can you share with us, in your own simple word, what are you doing on this?
I must say, I may not even have an answer across for you. There's something that I always share across with our team of advisors, and we always share across with them. If our clients can commit all their assets, all their money, all their finances across over to us, if they are near towards their end of life, shouldn't we walk this last mile across over with them?
I agree with you, and I can understand why you are doing it. Talking about it is easy, but you are putting words into action. On this effort to be there for your client, to walk with them the last mile of their life, this is not easy. And I think this goes beyond a normal financial planner and client relationship. To me, this is humanity. Thank you, Bernard, for your sharing. I believe your sharing about the work of an end-of-life companion will open up possibility for those who are looking to shape the last chapter of their life. In the first episode of Last Station, we have dived deep to understand the purpose of estate planning, which is to protect our loved ones from financial hardship and emotional stress. We expanded the common understanding of estate planning from the financial focused planning to include medical care discussion. We can start estate planning as soon as we have dependents instead of planning it at the last mile of life. From Bernard's sharing, we can see the significance of advanced care planning. A person can decide on the treatment and where to spend his remaining days. There are different levels of estate plannings. Most clients only make arrangements for their wealth distribution, which comprises of a will and a schedule of assets. You may have encountered some planners providing advice on how to distribute real estate assets, and some other planners offering whole life insurance product as a solution to estate planning. All these services are of good intent, but the client is receiving piecemeal advices, and there is a risk of conflicted planning. I would recommend for a client to go through a comprehensive estate planning. A comprehensive estate plan will include a well-thought-through will, which establishes who will receive your assets after your death, and when and how the transfer of assets will occur. The timing depends on the number of issues such as the age and the fiscal maturity of the beneficiaries. For example, if the beneficiary is not good at handling large sums of money, the testator can decide to release the inheritance when the beneficiary is much older. The timing of asset transfer can also depend on whether the beneficiaries have any disability and if there is a need to have protection from their creditors. Sometimes, in the process of will planning, you will discover you need to accumulate wealth needed to fund the dependents after you pass on. This is where investment and financial planning comes in. Additionally, comprehensive estate planning provides for yourself and your loved ones in the event you become mentally incapacitated. Your appointed lasting power of attorney will make the financial and legal decision for you, make your healthcare decisions, and have access to your protected medical records. Comprehensive estate planning will also involve setting up advanced care plans to decide on your preferred medical treatments. As you can see, a comprehensive estate planning will allow the client to address most financial and legacy planning holistically. In this episode, we saw the need to balance financial legacy with life story's legacy. And this balancing is possible when the patient understands his desire. In the next video, we will be sharing on events after death and how a comprehensive estate planning will avoid heartaches and arguments. We will bring in two professions in the estate planning industries, and these are the two people you do not want to meet too often, or maybe do not want to meet at all. Thank you for joining us, and see you in the next episode.